Thank you. Thank you very much for that, presentation, extensive presentation. And Dr. Fred, I'm just curious to pick your brain, as far as, Africa has no shortage of data, but really what the conversations that we hear out here is completely opposite. But also, you'll be touching on data protection, privacy, and trust in digital health. And we're just curious to understand what are some of these healthcare systems that we really should be excited or should be worried about?
Yeah, that's first of all, excellent. That was a very good framework to start this conversation. And now when you talk about innovation, as an innovator, very excited that a lot of these tools are coming to the mainstream, yeah? So I'll just give the example. So for example, this morning before I came here, I was running some code for some project we have with on TB microscopy and AI. Mm-hmm. And the funny thing is, as a doctor, if I was to have the best tools, I'll have to leave the country. I'll have to go to India, have to go to Johns Hopkins University, etc. But the funny thing is, with AI and all these solutions, like you can have the best cutting-edge technology in terms of models, etc., with an internet connection, and that's game-changing. So that's the one thing that really I'm most excited about. Most excited that, again, it's changing in a very fast rate, but you mentioned what also am I worried about. So if I was to wear the hat of a regulator, because currently we are supporting the DHA to write the guidelines for health AI in Kenya, we realize that it's moving so fast that even as an innovator, you have to pause and ask, okay, are we leaving some things behind? Are we saying these things will be sorted in the future? And it brings me to a quote by Mark Zuckerberg, who said, with innovation, move fast, break things. And as an innovator, you'll be like, yeah, power to that. But if you are, let's say, like an AI innovator in finance, like fintech, if you break things and your code breaks and you add a zero to a balance sheet, it can always be corrected. And even if it's not corrected, yeah, what's the difference? In health, if you add a zero to a dosage of adrenaline, that's somebody dead. And hence why there's always this thing that we have to have at the back of our minds. Even as we're thinking about centers of excellence, we have to think that innovation and regulation have to go in tandem. And innovation should not just, it's not the Wild West, if I would say so. So using such tools like guidelines, using sandboxes and other tools, we can be able to ensure that regulation doesn't hinder innovation, but ensures that we are safe. Because healthcare is one of those things that you cannot move fast, you cannot break things. Because when you talk about breaking things, you're breaking people. You're breaking families, you're breaking people who now they can't walk again because of something that went wrong. So in that regard, I'm really excited, but also with a hint and a small dose of skepticism that we still have to ensure that these tools are assessed, and it speaks well to our theme of having centers of excellence.
What you're saying is we can break, but be careful what you're breaking, not in health. And before we talk about digital solutions, Mr. Roy, I'd love you to rope in Joe in terms of understanding, because we've been told to distinguish between digital tools, health tools, and using it as, looking at it in the form of infrastructure. So from where you sit, how then do we, all of us, not just leaders in the healthcare system, but really all of us as people, how then do we distinguish between meaningful innovation and hype? Because we all get excited about things, when they come. So how do we distinguish between the two?
I knew that was going to happen. Thank you very much. That's a really insightful question. And from where I sit even today, as the head of strategy at Sunview Medipro International Limited, it's a question that I have to face each and every day And just by way of example, we've installed 40 CT scans over the last 1 year. So looking at what is hype when it comes to AI in a CT scan, for example, or in radiology at large, versus what is an actual application in AI that can actually save lives, move fast without breaking anything. And I think it's up to us as leaders or as stakeholders within this market and this industry to really think from, I like the idea of the sandbox that was talked about earlier. I like the idea of looking at data very comprehensively. So it's up to us as stakeholders in this space to really look at what are the specific pain points and be very clear, what are the pain points that you're facing? And therefore, having understood those pain points very clearly, if you're trying to save costs or if you're trying to do predictive analytics when it comes to saving lives, if that's the pain point, then what technology can actually serve that need from a reality perspective? What track record does that technology you're having has it actually achieved when you look at data across the world? And like today, access to data is really easy to come by. So it's not looking at fluff, sorry to use that word, not looking at the fluff, but looking at actual real-life case studies about technology that's actually working and actually solving pain points that is there. Now, at any given time, it's never that simple. It's really about being very critical and sandboxing and testing it in a very controlled environment. I'm a big advocate about piloting and trying to see the risks beforehand, but also applying that objective lens of feasibility. If this new technology solves the problem that I'm trying to solve, is it feasible from a financial perspective? Is it feasible from a risk perspective as well? Do the risks outweigh the benefits that we're looking into? Is it feasible from an when you're looking at a human lens, for example? I'm bringing in a new technology. Are the people trained to be able to use this technology? Or what kind of training and skills building do they need to look into? Looking at it even from a legal and policy perspective, are you breaking any laws by applying certain technologies, right? So there's so many different lenses that you need to look at it through just to be able to differentiate that hype. And we've seen everyone has been talking about AI over the last couple of years, but that solid lens and that objective and step-by-step approach, using it, from a gradual perspective, testing it in a smaller sample size before you grow on to that. And later on, I'll revisit the example of how we handle that for CT, for example, using AI.
I see, and I think one of the biggest concerns for so many people is AI is coming to take our jobs. So I don't know, people in the medical field, how that resonates with them. And Roy, just to speak on expanding access to quality healthcare through digital solutions, from where you sit, really, how then do we design solutions that first of all work for healthcare, before we even talk about common mananchi, before we even talk about specific areas as far as public health is concerned? How do we design the solutions that work, and what will it take for us as a country and as a region to get to that level where it clearly works?
Yeah, first of all, thanks a lot. Really happy to be on part of this panel. Very interesting conversation. I think we need to start by asking ourselves, is technology the answer? Because we are busy running into AI, digital health, but is it the answer? And I think for you to answer the question, first of all, is to look at the numbers. Some of the key statistics is that we have a population that, as Dr. Boniface said, falls into poverty every year because of healthcare concerns. And the numbers are 1 in 10 families falls into poverty every year because of healthcare. We are all in WhatsApp groups where we are contributing for these things. One of the other big numbers is, what is the average distance to a health facility in Kenya? The average is 5 kilometers. And that's because there's a huge concentration of facilities and practitioners in urban areas. If you go out there to Turkana, to some of our counties, it goes to 50 kilometers. So there's a problem. Will we build enough hospitals for the population? And the answer is no. So when we are saying we will rely on technology, do we have good enough internet penetration? Do we have good enough smartphone penetration? So smartphone penetration in Kenya, for example, is at 92%. So there's enough smartphones. But what about internet penetration? 48%. So there's guys out there without internet access. But also we are forgetting guys cannot afford this internet. So when you build a healthcare app, as my panelist was saying, is it going to solve the problem? And the answer is no. So to answer your question, we need to think if digital healthcare is the answer, how do we build for the African population? I'm sure you've heard before that by 2050, 1 in 4 people in Africa, in the world will be African. Now, if you analyze that a bit more, 93% of East Africa population is growing by 93% by 2050. So at the heart of this population boom in Africa, East Africa is quite central. So these problems I'm describing will become so much worse as we go along because population is scaling, our healthcare system is not scaling. From where I sit as the CEO of HealthX, we've been innovating for a while, and we are in digital health. But we are unique in the sense that we are an African health tech innovating for Africa. Most companies come to Africa thinking they'll come with very cool app. You give Africans and it will work. It's not going to happen.
And we get excited about it.
We get excited. There's a lot of fanfare, but it won't work for us. We have to think of solutions for the Kenyan population, for the bodas, the mamambogas, and some of the stuff we have managed to do, which makes sense, is solutions around USSD, for example. Can someone buy a healthcare solution using USSD? We've done this very successfully for boda people. Can you use toll-free to speak to a doctor? Instead of an app, can you use toll-free? And what about the guy who doesn't have a phone? So we built also something called virtual clinics. You can go to our booth out there and you can see how this looks like. So basically, a room in a village where someone can walk in without a phone, without a device, speak to a doctor virtually. And this doctor is sitting at a call center here in Nairobi, and they speak your local language. Because the other thing, as innovators, we forget is the population out there cannot speak English, they cannot speak Swahili. So we've managed to also think of such solutions. What about the guys living with disability? So can someone do Kenya Sign Language as they consult? So I think as we innovate, as we deploy healthcare solutions, think of the population and innovate for that population.
Yeah. And that's a really important point because most of the time, like we said, we just get excited because, oh, AI is coming, oh, this and that. There's a lot of conversation on telemedicine, but you know what you're saying, if someone does not have access, say to a smartphone or even a phone, what happens? I'm really curious about that. I'll be sure to visit the booth and just to see how that works. But Dr. Boniface, wewe sasa umewasha moto, okay? But when we're looking at digital solutions and health, in digital health in the digital space. So how then do we move? What are some of these, foundational, I would say weaknesses that has put us where we are today, not just as a country, as a region, to a level where we view, the digital space as an infrastructure and not as a tool?
No, thank you very much for that question, and again for having me. It's interesting. The foundations that we need are fairly issues that we can provide. I'll break them down in a couple of points. For example, we talked about a build problem. We talked about what the population need. Our foundational issue would be, does the population really need that? And if the population needs it, are we able to afford it? And if we are able to afford it, then how much can we roll it out? And if we roll it out, would it be taken up by the people? I mean, we can build something, maybe we will afford it, we can afford it, but maybe the people outside there may not be able to take it. So for a digital healthcare kind of a platform to operate and have these foundational components that are important, so a couple of things have to be done. So we have to build for the population, as has been said. But I think the other important point is that for every connected system, there must be interoperability elements. I'll give an example. If, for instance, today as a doctor, I wanted to, or as a planner, I wanted to know how much the government has put aside for digital healthcare app. I don't have to call someone, for example, at the ministry, whichever ministry is concerned, and ask them, how much did you put into perspective? No. We must have systems that are very open and interoperable. Maybe someone in planning should have done something that is fairly open and said, we are allocating 1,000 shillings so that a digital system is invested. And if we are allocating this, then we have a gap of this that needs to be filled. That needs to be just open. I'll give an example of Estonia. Estonia has this system called X-Road. It's been there for a couple of years. Of course, the problem with Estonia is that it is a smaller population, but I'll use the example either way. So this X-Road means that for any person who seeks care, they have just a unique number, one unique number. And that unique number is something that they can be identified with, say, at the hospital. If you go to a hospital today, you present yourself, all you have to provide is a unique number, which you will be identified with. If you go to a pharmacy, you don't have to provide another number. You just need to provide a unique number, and the pharmacist will know that, for instance, the doctor has seen you and this is what he has prescribed, even if the two people are not within the same setting. If you go to, say, for instance, an educational system and you want to enroll a child, all you have to do is this unique number. Provide the unique number to the school and they would be able to access your system. Of course, it comes with consent. And the second part would be then the regulation. How do we regulate the system so that the foundations are very strong? If we regulate it in such a way that it is not misused, I'm not, say, a policeman who will use your number to punish you. Let me use your number to help you. Let me use your number to know what problems you've had so that I can solve it. So there is that, the regulation part of it. And other foundational issues would be capacity. Capacity is very important. We are intelligent people. I mean, our youthly population, someone is able to design a website in 15 minutes, for example. Long time ago, that would take a couple of days. Now, with the digital elements and all components, we can do it in a very short time. So can we capacity build the people as well? So these are foundational issues. And I think one was touched on when we were speaking about really putting things in the open. The openness and transparency through which all this is done. If those are observed, I feel these are foundational issues we can put in place so that digital spaces, one, are acceptable, but at the same time, they are useful to the people they intended to use.
I see that. And John, let me just rope you in now, because when we're talking about AI technology, there must be people, working with technology. So then how do healthcare institutions probably prepare the workforce so that we don't get to a point where there's no capacity? We have not empowered, say, the healthcare providers to work together and in tandem with AI and the technology that comes with it.
Yeah, a really good question, and I'm really enjoying the discussion. Once again, thank you for this opportunity. I think I wish to respond to that question by way of example. So what we do at Sunview Medipro International Limited is essentially provide medical equipment to facilities, but we don't stop at equipment. We also provide consumables, we also provide reagents, we also provide the maintenance, and we also provide what you've talked about in terms of training, right? So previously, just with the previous example I was just highlighting, when it comes to CT scan, for example, the innovations that we've made within CT scan include working with manufacturers like GE, Philips, Fujifilm, and deploying the latest technology within CT scan technology. That's making sure that those machines are AI enabled, right? So this AI enablement serves a lot of purposes. Number one, it addresses, one of the panelists talked about access, right? Access to the service. So inbuilt within the system, that's the CT system, but also within our SunView softwares, we have a picture archival system which enables teleradiology reporting. We're all aware that we have a shortage of radiologists in the country, but then there's an increasing need for CT scan reporting across the country. So one of the innovations that we've done really well is to make sure that not only are we installing the hardware, but we're also installing the software at the local level, so that if you have internet or you don't have internet, you are able to access the scan and do the reporting. Another thing to address the internet aspect, we've gone beyond our mandate just to make sure that, in very far-flung areas where there's no internet, we're actually providing the internet service. So that these images, once the radiographer does the scan, they're able to be accessed by a pool of radiologists who are not seated within the facility. Right? So when it comes to the installation process that we do take a lot of time, about 5 days, to build the capacity of all the users within the facility. Not only focusing on the direct users like the radiographers within the facility, but also the users who are secondary to that, just so that they're able to understand and appreciate some of these new technologies, right? Now, focusing more on the aspect to do with AI, some of the benefits that we've seen, like I said, over the last year in Kenya alone, we've done over 40 CT scans across the country, from level 6 facilities all the way to level 4 facilities, right? So some of the challenges we were seeing before the installations is the increasing workload, whereby, radiographers, radiologists, doctors are really getting tired with the entirety of the workload that is there from conducting this critical service. There were also aspects to do with staffing shortages. There were aspects to do with variations in image quality. There were aspects to do with raising patient volumes. By the way, over those month on month, we are doing over 12,000, 13,000 CT scans, right? So you can see the volume is increasing, and it's really increasing every month. Another thing that's also interesting too, and it would be interesting to hear the perspective of the doctors, is also the increasing complexity of cases as well, right? So that was the business case that we were looking at. How can we help resolve some of these challenges by using technology and using AI? And what we've done is to make sure that the machines are AI enabled, but also that they have tools that are easy to use for those administering those services, so that it saves them time. And what we've seen is a huge reduction, over 50% reduction in time that it takes to acquire an image for a CT scan, just for example, right? Another thing that we've seen is that the patient experience has improved because we're able to provide AI-enabled tools that make it easier for the technologists to pre-select and increase that accuracy. It saves them time even on how they're positioning the patient based on what study that they've come to do, based on what's ailing them. So these are just some practical ways that have helped not only reduce the time that's spent, but also enhance access to this critical service, at the same time reducing the workload. And from the surveys that we've done across these systems that we've implemented, we've seen 90% of the users saying we've been able to do 10 more additional scans every day, just because of this implementation of technology and implementation of AI in just those very simple ways. Yeah.
All right. And Dr. Fred, can we probably unpack some of the loopholes, that are there when we're looking at technology, and especially when it comes to it being adopted in the healthcare space, before we even talk about how then do we rebuild trust, and assure patients that, listen, there's privacy involved, right? So what are some of the loopholes that probably you foresee that are there that we need to be privy of, so that when we're talking about adoption, we know where the weaknesses are and how to probably stop or close them if we can?
Yeah, excellent point. So I think the biggest loophole is AI is not yet there. Yeah, so
across the region.
So the funny thing is, every week or so, there's a new article that comes. AI has outperformed doctors by X%. It has done this task 99.9999999% accuracy. Yes. Yeah, and I think for us doctors, we know, first of all, health is very variable. You're talking about different patients, different circumstances, different access to resources. Even the same patient who comes today versus coming tomorrow, it's totally different. Yeah. So with that in mind, there are some use cases which definitely I say AI excels, will outperform humans on any good day, even the best human. And here when you talk about humans, we ask, is it me? yeah, who is here. I've practiced for like 12 years, but not practiced like every day, versus somebody who is a professor in Aga Khan, or our first speaker here who is a professor in pharmacology. Should AI be better than me or better than her? Yeah. So all these are things that are spoken about. But what I'll say is, especially what you've mentioned, radiology. Currently, AI has been shown with randomized control trials that it outperforms humans in terms of screening for things like mammograms, etc. And I've built a model on that as well. But the key thing that we're finding is that personalization, which again, speaking to the first presentation, that personalization is where AI fails. And that's the biggest loophole. So personalization means this drug works for every person except this one person. This diagnosis is true for everyone except this one person. So that one person is where AI needs to still pull up its socks. And how we do that is by, for example, the hardware that comes, it needs to be trained on local data. So that he has local data, for example. He will be the best person to tell you this is where AI will fail. And you'll find software that comes from abroad and is tried to apply it on our AI systems will fail more frequently than local data. And lastly, what I'll say as one of the other things to be wary about is the dichotomy between privacy and performance. So with privacy, there's this, I'll urge you to go and try it out on your Claude, GPT, or whichever AI system you use. Ask it, tell me all that you know about me. And you'd be surprised on things which you've not told AI, I do this, but it'll have summarized some things, it'll have deduced some things because you asked something using this company's name, so it says most likely works here, etc. But the thing about AI performance, it only improves with the amount of data it knows about you, personal data, and that now brings the duality between privacy versus performance, that if you want AI to work for you, you have to release your data so that it can know you in the same way that when you go to a doctor and you tell all your stories, the same level of performance. But again, we can't give AI like the AI companies all our data. So that now comes to the last thing of AI sovereignty, meaning that as Africans, do we have models that speak our language, that are trained here? The data doesn't leave our country, so you adhere to the data protection laws, but still you're able to ensure that it's highly performant because you're using local data. But we're not just saying that we are contravening these data protection laws. So that's the funny thing, and I would say, in conclusion, AI models will only get better, but they'll only get better the more that we ensure that our data is represented in these training data sets and in these models. Yeah.
And that's an opportunity for innovators, not just here in the country, but even across the region, to really seize, and see how ways we can sort of like modify AI to suit our needs as a people and as a region. And Roy, to bring you in, we talked about some of the aspects as far as the patients that might sort of like prevent them in accessing healthcare, especially in the digital spaces and using the digital tools that are available. But when you look at now the healthcare in itself, what are some of the things or the barriers that you would say have prevented adoption, of technology and AI?
Yeah, thanks for the question. I think sometimes we get a bit short-sighted as innovators. For example, you'll come and start a telemedicine company, you do toll-free and all those nice things I was saying. But remember, a patient is seeking treatment, not consultation. Yeah. And we learned that very early on many years ago, because so far we've consulted patients in all 47 counties, but someone calling you from Migori, for example, but you cannot provide medication. You cannot provide a referral system. You cannot provide lab services if they need. You're wasting their time because that consultation was meaningless. They would rather do that 50 kilometers, I was saying, and they get treatment. So when we're thinking about innovation and the challenges we've been facing, number one is how do you provide a complete care? And that means integrations between private players and also with government, because in Kenya, our healthcare is decentralized. It's at county level. When you now then decide to work with counties, other challenges come in, like the credit risk of you not being paid. So innovators then shy away. And you'll find many digital innovators in the healthcare space only innovating for the private sector, and they are concentrated in Nairobi because they are fearing going out there, they will never get paid. Yeah. I think the other big problem is affordability, and people have said it. We have a very low private insurance penetration, less than 3%. We all know the challenges that SHA has faced because people only pay for SHA when they're in hospital. They're there on the queue, then they pay for SHA. So many people then are not able to afford healthcare. But as digital players, we know that we can crush the cost of care. For example, in our company, we have doctors on shift 24/7 sitting in a call center. This doctor will serve a patient in Mombasa now, and in the next 10 minutes, they're talking to someone in Kisumu.
West Pokot, where I come from.
Yeah. So then that doctor is not moving. They're there. You're able then to crush the cost of care. So we need to think innovatively of solving that problem. Access, I mentioned already. That means giving rails where patients are able to access, whether they're in the urban population or rural populations. But then the question of affordability, we have to be innovative. We have to think, how do we partner with underwriters to introduce microinsurance? How do we partner with telcos to introduce frictionless daily payments? The payment cycles for most of the people in our economy is not monthly. Guys are earning daily, they would prefer to pay you daily or weekly. So how do we innovate with guys like M-Pesa so that guys are deducted daily, and then there's an underwriter on the back of that for them to be able to get some form of insurance? And let's not complicate it. Let's give guys something called Hospicash, last expense. So very light micro insurance covers. So just to wrap it up then is, we need to build interconnectedness between the players so that when someone uses digital health in West Pokot, they're able to go through a referral pathway to get their medication and lab services. How do we partner with other players in the healthcare ecosystem to make it more affordable? Then we solve the problem of accessibility by being innovative around the rails. So you'll have solved accessibility, access, and affordability to quality healthcare at a very large scale. Maybe lastly, to speak about AI, you asked a question around whether it will replace the doctors, and the answer is definitely no, from what my panelists have said, because the doctors who don't use AI, that's where the problem is, because AI is meant to make our lives simple. One of the biggest challenges with AI is the data behind it. AI is only as powerful as the data behind it. In Africa now, we have a big opportunity because when you look at all the models that Dr. Fred has mentioned, GPT, Claude, etc., they're relying on data mostly from a Western world. Nobody has our data. Nobody has the African data at scale. At a sovereign level or at government level, how can we us to scale AI, both at level and clinician level? All these people in the room, I can guarantee, are using Google or AI to ask some symptoms and stuff. But that data or the LLM behind it is using Western data. So how do we leapfrog? It was able to change the financial services world. With AI, as Africa, we are sitting in a position where we can leapfrog the West and control our data, meaning the pharmaceutical stuff the professor was talking about earlier, medication research, it becomes even more meaningful for our population than just generally speaking. So that's my opinion. Thank you very much.
I see that, and thank you for highlighting that. At some point before we end the conversation, then we'll touch on data protection and privacy and also trust. Because we're thinking my grandma Noko was Pokot, convincing her that, listen, this is okay and everything that you're offering is safe. How do we do that? But Dr. Boniface, we cannot talk about healthcare without talking about healthcare investment and financing and how big of a deal that is and where we should really factor in. So from where you sit, do you think technology will solve the fragmentation as far as healthcare financing and delivery? And if so, how?
No, thank you for that question. But before I answer it, I want to give something I tried that has been raised here. I once went to ChatGPT, the Ski-Space version, the one we use for research, and asked it, from everything I've ever fed you, can you describe me as a person?
Okay.
And two things really came out. It said, you are a perfectionist and you like things done to the letter. And it gave quotes in terms of the prompts I was sharing.
Okay.
It went further and gave me a solution and say, for you to live a better life, you really have to tone down on your perfectionism. And so just to show how much we give this system. But back to your question on fragmentation. Can digital infrastructure solve our fragmentation problem? A bold answer is no. Digital infrastructure cannot solve our fragmentation problem. However, a well-governed digital infrastructure definitely can. And I'll capture a couple of things why this is so. So when we talk about our systems and these systems that are helping us in healthcare financing in terms of cost and in terms of everything we have spoken about, it's from the planning perspective and from the policy makers perspective, we all need data to make decisions. This data is available somewhere, and we need to digitize system so that we solve this problem of having multiple sources. So how do we aggregate it together? So if that's governed properly, then we can solve it. Now, one of the key things why digital health in a well-governed digital healthcare system would solve our problem is we need to make decisions from multiple levels. Let me start from a clinical service delivery perspective. Doctors, nurses, healthcare workers need to make decision from that level, but you can't make that decision if something, for instance, is withheld from you. I can only make a good solution based on the information I have. So if I'm a doctor let me use West Pokot now that you talked about it. If I'm a doctor in West Pokot and I want to treat patients and offer them a solution, then one of the key things that would be relevant for me would be, for example, to know from a county perspective, how much, for instance, was I allocated? How much drugs are there in the pharmacy? How much healthcare workforce do I need to do a certain thing? So from a delivery of care perspective, we need to have that information. It's in multiple sources. It's everywhere. If it is integrated and it's governed properly, then from that level it would be important. From a financing perspective, let's take a case in point of our pooling system, the pooling system we have now at SHA. Only a few people, unless told, would be able to know how many people have registered for SHA, isn't it? It's quite a handful of people, and occasionally we see the CS or PS or those at the top coming to tell us, for instance, that we have 19 million people who are registered as of yesterday, for example. And we are also not able, for example, to tell from that financing perspective how much, well, we know the benefits package that each of these diseases are catered for. So, for example, if I want to have a surgery for a particular disease or complication, I would know how much it costs. But not everyone knows that. That information sits somewhere. how can we then integrate all this information in multiple pieces so that even me as an end user, the person for whom this is given to, I'm able just to get it by a click of a button. If I go to the internet today and search for how much does it cost to treat malaria, and I have a share cover, I really have to go back to the benefits package document and read through it and see, unless you go to the hospital facility or to a share person who then can break it down for you. And still, if you seek care at the delivery level, there are instances where we've had sick people. We've all had sick people in the hospitals, and we've had to pay for it. In your own calculations, you are comfortable enough, for example, that say 200,000 or 100,000 would be adequate for a procedure. You go to a hospital, then you're told, for you as a person, SHA doesn't cover that cost. SHA covers only, for example, bed charges, override charges, rebate. What would you do? You had 100,000, you knew that would come into perspective for your treatment, but then you find out that it's not enough. And what's enough is, say, 10,000. How do you treat this gap? That information would have been relevant for me if by a click of a button, I just knew it, isn't it? If I'm not a healthcare specialist, I may not be able to have that. And we have few healthcare specialists. A majority of us would want to seek this information. So there is multiple information in every system. Multiple systems are fragmented. If there is a way of putting it together, and for us to put it together, we need governance in terms of what we share. I mean, it could not necessarily be, for example, just sharing the actual data, but it could be sharing APIs in a governed fashion. If Treasury, for example, could share APIs in a governed fashion of the products of IFMIS, which is what we use for planning, then I would be able, for instance, to know what the plans are, what the money is about, how much goes into the system, and et cetera, et cetera. So there's need to share the APIs component so that information is not scattered everywhere. And that comes with good governance. So we don't give power to every single person the way we give AI power in terms of what we feed it. But it's important that when we give information and when this information is needed, then it's brought into perspective that we are able to use it. And if that is done in a good way and in a cooperative way in that we involve government, say as regulators or regulators, we involve innovators, are well involved, we involve academicians, we involve every single person in a divide, then we would solve that problem and see what it is needed to come up with. Yeah.
Thank you so much. And we've talked about the loopholes, we've talked about the opportunities that are there, but really when it comes to then encourage the adoption, and this is now from the patient perspective, what sort of ways can we do to ensure that there's data protection, there's privacy, and also trust? So Dr. Mutise, probably very briefly, and then Joe will come to you to understand. So then how do we build structures around technology and AI? What are some of the areas that we need to strengthen so that before we do is it a mass rollout, of AI technology in healthcare? Very briefly, we have less than 10 minutes before we end the conversation. Yeah.
Yeah, sure. So, trust in AI is a big issue. So I'll give the example of we went to Singapore, the real Singapore. 2 months ago, we were invited by AI Singapore and the Ministry of Health, and we had a chance to tour AI Singapore, which is the institute that builds out a lot of the solutions that are used by Singapore. And the issue about trust was that first of all, the fact that that institutionalized one body that dealt with all AI regulation, building, put a lot of faith that somebody who has an idea of, I have this innovation, who do I need to go to unlock this data, to give me access to Roy and his expertise? That was the place to go. The other thing is Air Singapore developed a sovereign AI model for Singapore. Actually, they expanded. It's called Sea Lion. I would encourage you to go and check them out. So they developed sovereign AI for their region, Southeast Asia. That brings a lot of trust, because once you know that this thing has been built by you, in terms of, you say, I know that person, he's the one who built it. It was built here, the data is here, and it's controlled here. And the funny thing is, all the funding, no grant money, no external funding, all taxpayer funded. And it ties with our Health Information Exchange, which is also taxpayer funded. And it shows that to cultivate the same level of trust, number one, we have to do it ourselves. We have young people who are very skilled. We have excellent companies, HealthX, and other people who have been in the space that they know what it takes to build a solution in Africa, and specifically in Kenya. So how to do trust, just build it for us and by us, and the trust aspect will be solved just by itself.
Right. I think for your parting shot, we'll look at protection and privacy before we close the session. But yes, Joe, in terms of before we scale out the technology and AI in the healthcare space, what are some of the areas that we need to strengthen? And probably if we will allow room for just one or two questions before we wind up the conversation. But Joe, please go ahead.
Thank you very much. And I think there's, full agreement with my fellow panelists here in terms of governance, in terms of integration, in terms of bias of the data that is there. I just wanted to highlight a few things, because the theme of this panel was about how do we drive healthcare using technology? How do we drive this excellence using innovation and AI, right? So to answer your question, I was just thinking about, earlier we talked about Sanvi as a player in CT. But I want to give a different example, because we also are a big player in lab equipment. So far, in the last 1 year, we've installed over 400 labs across the country. And within that space, the way we've been able to use technology and AI in a trustworthy way is to set up very clear governance structures. We external to the organization, which basically entails a lot of compliance with DHA. DHA has put out a lot of data control governance. That's the Digital Health Authority. They've put out a lot of data protection regulations and policies that, in as much as they may not define everything relating to AI, they have a very clear footprint or policy framework around how we need to take care of data. At the same time, when we speak of integration, the Ministry of Health, the Social Health Authority, DHA again, we have been working very closely with them just to find ways to integrate this data, working very closely within that policy framework. So what does this happen? What does this help us do as an organization? One of the things, and I know you talked about financing, one of the things that sets us apart as an organization is we do not sell our equipment. We place our equipment within facilities. If it's a CT scan that's worth north of $1 million, we place that equipment there, and then at every time that it's used, we share the revenue with the facilities. So this really brings a lot of access when it comes to much needed equipment that's capital intensive to the facilities, but also bringing the latest equipment that's AI enabled and tech enabled, just addressing that aspect to do with financing, right? Another aspect that enables us to do that in the right places, we work a lot with AI when it comes to, finding places where the demand is highest driven. For example, a place where a hematology machine in the lab is needed more than a biochemistry machine in the lab. So we do use a lot of technology, we do use a lot of AI, and our experts work alongside, and I think that has been the theme that we've been talking about today. Our experts work alongside this beautiful technology to be able to understand where this need is greatest, where the patients who need this access are really greatest. One of the things I wanted to highlight, now that we talked about West Pokot, next week we'll be piloting one of our innovative partnerships with Wings to Fly, because in addition to placing the lab equipment, we're also required to provide these reagents so that the tests can be done. So in addition to embedding AI to find out, just making sure that just-in-time logistics and consumables are there when they're needed, so that you're not doing a scan and you don't have a certain reagent that's there. We are also deploying Wings to Fly, using drones to even deliver much-needed consumables in far-flung areas So far, we're working with over 600 hospitals in Kenya, places like Wajir, West Pokot. So really need that service. So just another way in how we are using technology to be able to reach or bridge that gap when it comes to access. And again, using AI to identify where that need is greatest and at what time it's also greatest. So specifically when we talk about trust and structures, I think it's like you would look at any other technology or any other innovation. We need to be very clear from a governance perspective. I like the idea of Singapore, that's benchmarking, looking at things that have worked in other markets, things that have worked even within other markets across Africa, things that have worked with companies who have been innovating within Kenya. There are really many ideas that are there, but fundamentally it's about creating that governance structure at the national government level, even at the county levels, and within the facilities that we are working with. These are the hospitals, whether it's a level 6, a level 2, a level 3 facility. These governance structures need to be in place to govern technology, to govern new innovations, to govern data protection, so on and so forth. Right. So again, there are many other interventions from a process and a structure, and most importantly, from a training and capacity building assessments. Training and capacity building lens that also need to be looked into to be able to make sure that these rollouts are safe and that we are not breaking as we move on. But I wish to just conclude by saying AI is working. From technology is working. It is saving lives. It is saving cost, and it is making sure that practitioners are able to deliver better quality when it comes to service delivery. And that's something as Sunview we hold very dearly. And our motto is to empower every care. That's why we are really excited to have this conversation. Thank you.
Thank you very much, Joe. And like we said, we'll only allow room for 1 or 2 questions. So if you have a question, please raise your hand so that we can have the mic passed on to you. I see 1 hand there. So 3 questions. But as we pass on the mic to you, Roy, I just want to bring you in because I know this room is full of innovators and also startups, right? So what role do you think they play in shaping the future of healthcare delivery in brief, and then we'll engage or we'll answer the questions.
It's a very good question, and I'd like to lean in on what Dr. Fred said, that we need to build for Africa. The opportunity is massive. There's no time like the present, and I wish I was younger, because the guys who are, I think, around 18 to 30 years old right now, if you're innovating for the future, you're in a perfect position, because there's a quote by Sam Altman, the founder of OpenAI, and he said Africa is going to be the most important market for most companies in the coming decades. And that's largely because of population boom, but also if you think about smartphone penetration, internet penetration, very young demographic, the time is now. We need to innovate for Africa by Africa, and the opportunities are endless. And not only in healthcare. If you think about renewable energy, you think about agriculture, there are so many opportunities, logistics. So for the young guys, young innovators in the room, the time is now. You need to innovate, and in the next, not so many years, you'll be the next billionaires.
Look at that. I think that's a really good point, because when you think about billions, we all want to be billionaires, right? So start thinking now and seize the opportunities that are available. So for those of us who have questions, please keep your question very short, straight to the point, and let us know who you are directing your question to. Do you have a mic? All right, who has the mic? Please stand. All right, I think there was a hand at the back, yes. So let's pass on the mic to him. Please keep your question very short and straight to the point. It's almost lunchtime and we do not want to come between people and their food. All right, so please stand and start by your name.
Hello, my name is Quinton Joroge. I'm the founder of Afianova Innovations Limited. I'm building an infrastructure business where we link telemedicine, e-commerce, pharmacy, and InsurTech in one platform, in an ecosystem. Now I have a question for Dr. Fred Mutisia. Since you're an AI consultant, how can AI make sure that Kenya, as we advance to the 2030 agenda, to become recognized in Africa as a healthcare tourism destination in Africa and even in globally? How can we achieve this goal in less than 4 years?
Less than 4 years. Okay. Thank you so much for your question. Who else had their hand up? So there's a hand, yes, on the side, and then. All right. Thank you. Please stand. Yes, thanks.
Yes, hello everyone. I'm Steve Ochieng, founder of Medicheck. Medicheck is my AI app that I'm building right now that can help you to diagnose yourself. Maybe you cannot access the hospital. Maybe you are in an office working till late night. You can't access the hospital. You can use my app to connect with the doctors outside, maybe in Kenya, Tanzania, or France, to get diagnosed wherever you are. So I came up with this app because right now we are facing a lot of challenges in misdiagnosis in Kenya. You find that 3 out of 10 people are being misdiagnosed every day with these or same doctors. So I want to direct my question to Dr. Fred Mutisie, that is it the right way to use AI tools or use these technology tools to solve these problems like misdiagnosis, or how can you see it as a doctor? Yeah.
All right, thank you so much. Mseba tuwasiende Dr. Google watumie your app. Okay, all right, and then, yeah, last question here at the front. We have yes, we have this one here. He had raised his hand. Yeah, can we pass on the mic to him? Thank you.
Okay, good afternoon. I'm Robin Munene, the founder ICADEX Systems. We are focused on ensuring all mothers and children access continuous and safe quality care. So my biggest question is, how do we maintain an environment that allows innovators as well as developers to have a clear space on building without much regulation and quality governance? Then the other question is, how do we improve access to innovators? Because I believe most startups die because of lack of funding. So how do we bring these VCs and the people funding these systems to the ground so that they can be able to interact with these ideas? Because most of our ideas die in our brains. Yes.
All right, thank you so much. Let's answer those in a minute or less.
Excuse?
Where are you? Oh, okay, sorry, I couldn't see you.
I've been standing here for quite some time.
All right, sorry.
Mine is simple. The private sector in AI is running at 100 kilometers per hour, but the regulator is doing 0. I'll give you an example. You've gone to a high, you've been diagnosed with a disease, and then you want to go to the pharmacy. And nowadays, I don't know whether the Drugs and Poisons Board is working. You can get very poor quality medication. Yes, you've got the diagnosis correct, but when you go to check on the pharmacy, you get that the medication that you are getting is of poor quality. One last one to Joel. AI is good, and when you've done your CT scan, your eye has regenerated a report. I am in a space where some clinicians, senior consultants have declined to accept a high-generated report, and then you have to go back some kilometers to get a radiologist or wait for I can give you an example. In Embu, we waited for like 7 days for a radiologist to come and report, where we had actual high-generated report. Thank you.
All right, thank you. So a comment, I think, and a question. So if we can answer those in less than a minute, and when you're done with the answer, please give your parting shot in terms of moving forward, what needs to be done, or how do we strengthen aspects of technology, AI, and healthcare. Do you want to start, Dr. Mutisi? I think you had 2 questions.
Yes, 4 years. They say the best time to plant a tree is 20 years ago. The next best time is now. So I think it's just start. We are not late. The good thing about these models, they're moving so fast. No one can say I have 20 years experience in ChatGPT. Yeah. So, and there's a new model that came out last week. So you'd be sure if you start now, you would have enough experience compared with somebody else who started last week. So start now. And just to your point, we need to harness the youth dividend, get our students from high school, the way people used to go from high school, used to go and do computer packages. The new computer packages should be AI. Like just learn all these AI packages so that you are competent for the market. The second question regarding misdiagnosis. Yes, so actually as we are at that inflection point that the quantity of healthcare is almost reaching saturation, meaning that we're almost getting to that point that there is a facility. Infrastructure is there, and now we'll get to a point that now the question is, I've gone to a facility, but have I gotten quality of care? So with quality of care, misdiagnosis is a big issue. Misdiagnosis is the 4th commonest cause of death in the West. In Kenya, we don't track it, and that's why we still put malaria, TB, HIV as top causes. But when you ask what is the burden of misdiagnosis, you'd be surprised that it becomes top 3. So I totally agree, and happy to see you create solutions in that space. And I'll just speak one last thing. As doctors, we are not afraid of being told we are wrong. In fact, that's something that we welcome. So be sure that as you innovate for this specific niche, note that the doctors will be more than willing to adopt it so that we prevent misdiagnosis on our end. Thanks.
All right, thank you so much. Yes.
No, thank you. I think it's Ruben. Did I get it right? He asked a very important question that resonated with me, or rather with some work I have done. Access to innovators, and how do we give them a clear space? I'll use an example. I worked at the regional office of WHO a couple of years back, and one of the key things we did around innovation was to create a platform for our continent that everyone would share something they were doing around COVID-19 and response work that was happening then. Of course, that was during COVID-19. So we received a total of 1,000 plus innovators sending in things they'd innovated and that they thought would solve problems around challenges that different governments were experiencing then. That's a very important thing. And it just showed us that we had very many ambitious people who were out there to solve problems without necessarily being told that this is what you needed to solve. And in this platform, most of them were, of course, young people. And they were given an opportunity to share, what are you solving? We are giving you money to make sure that you put it into perspective in whatever setting you think through. If it's a village, if you want to track people who've contacted COVID in a village, we are giving you money to go really and put it into perspective, 1,000 of them. After some time, when we evaluated what everyone had done, only 10% of the solutions were sustainable and were solving the problems that they had initially been targeted at. What does this tell you? Innovation is a good thing. It's a good thing because we all have problems we want to solve. It's like research. When you're doing research, there's nothing new down here. Somebody somewhere probably has thought about the problems you want to write about or solve about. You could just twist it a bit and make sure that it solves the issues. But a platform such as this one would be important, just to answer at you. Could it be a platform that is generated or given by, say, not a developer, but a philanthropist? Yes, it could be. Could it be a system that can a government, for example, take responsibility and invite innovators in specific areas and see whether these solutions can be tested and put in scale? Yes, it could be a government. All we need is a space and a responsible fellow to take it up and make sure that it is tested and done into perspective. And that's a thing we can do. But that also points out the fact that when we are innovating, then we need to innovate with the people We need to innovate with the people for whom these innovations are targeted to. If you are working with the mothers, a place I'm very passionate about, go, for example, to the wards. Look at how delivery is done. Is your solution really providing a solution to those people who are there in the ward, in the delivery room? Are you solving NC problems, for example? What is it you are? What aspects of quality? Is it a technical quality question or is it an outcome quality question? So a couple of elements just to put into perspective, but just to give a parting shot. We're talking about digital, how digital elements can be used in enhancing or creating solutions. They are important, and yes, they can create solutions, but we need to, like I've said, build with the people, focus the problem on the people always. When we are creating a solution for the government, like we are doing at SGHI, you need to work with the government, know where the problems are. It would be bad to finish developing a whole dashboard or a whole system, then as a user, at the planning perspective, I say, no, this does not solve my problem. We need to work with those people.
All right, thank you so much. Joe?
Yeah, thank you very much. I think there were two questions, but just before I respond to that, I wish to encourage the innovators in the room, especially the young innovators. Keep going. Those are really good ideas, even as they were asking the questions. Those are really good pain points that are there. Be resilient, seek out incubator programs in government and in private sector. I've seen that work for many developers to be able to access either that financing or to access that visibility that you need to have, including this platform. So it's really encouraging to see you here. Keep being resilient. The theme is building excellence, and to me, excellence is it's a moving post. It's about looking for that continued improvement, which brings me to my very brief response to the question that was asked. And change is a process, and they say a journey of 1,000 miles begins with a step. We've invested a lot in capacity building and training all the users when it comes to some of these AI use of tools within everything that we do, whether it's in the lab, whether it's in the theater, whether it's in the radiology room with the CT or the mammogram. We've really invested a lot in capacity building. It's a process of change, and with time it will become very clear to all the stakeholders how they're able to accept that. But just to clarify, how we use AI within the CT scans is not to auto-generate a report. It's to help with the process of acquiring the image, making that process very seamless, making sure that the technologists follow the right procedure, making sure that the technologist is exposed to learnings that we've talked about from different hospitals, different regions, so that they can administer the procedure in the best way possible. It also helps the radiologist or the doctor interpret and do the reporting, so it doesn't auto-generate a report. It can, but we are not yet there. We are taking it gradually, so that right now it's currently assisting the health professionals in enhancing the quality and accuracy of the reporting. But I would love to hear more. And just to point out, we have our booth just right here, and maybe we can engage more to see how other things that we're not able to talk about here, like applications of AI and technology when it comes to theater. We've installed over 200 theaters across Kenya just in the last 1 year as well. So there's so many other applications that technology, innovation, and AI that we have done. For example, we maintain 95% uptime of all these installations using AI and using Internet of Things, so that we're able to do the maintenance. We predict the failure rates of certain parts, and we're able to provide them just in time to make sure that the service is not disrupted in any way. So my parting shot is to thank my fellow panelists, to thank the moderator, to thank NTV for this fantastic discussion, and keep innovating to achieve that excellence. Thank you.
Thank you so much, Joe. And Roy?
Mine will be very brief. I'll take the question around funding for innovators and startups. I think it's a very interesting time because money or funds flow has dried out, especially with the Trump government. You've seen USAID slowing down. So the money flowing in for innovation is a bit dried out. So what I would encourage is join accelerator programs. There's a couple of them. Join innovation labs. Safaricom has one called Spark Accelerator. Britam has one called Beta Lab, and there are many others. So try and join those innovation labs. The other advice I would give is also go for grant money. As much as the USAID money is not there, there are other grants which would fund your innovation. The other thing is, once you've proven your idea and you're solving a problem, try and scale rapidly. And I would advise use partnerships. Some of the biggest partners you could get in this country would be telcos, Safaricom, for example, some of the underwriters or insurers, and some of the banks. They will give you rapid scale. That way you shorten your path to profitability. So that's some of the things I would advise for the innovators. My parting shot would be, for government, they need to help us with data sovereignty. We need to control the narrative. We need to own our growth. Why can't Kenya lead the line when it comes to AI? And I think that question has been asked to Fred. So you need to advise government. How do we lead the line when it comes to AI, like the way Singapore has done for Southeast Asia? Then for the people in the room, how do we support our local homegrown solutions? And also be careful, because with innovation, with AI, there'll be so many quacks. There's so many risks, and you cannot afford to risk your healthcare with some of these solutions that are out there. So all the best, and thank you to the panel for the great conversation.
Yeah, and thank you. Let's appreciate this amazing, amazing panel for beautiful insights and really strong insights. And I think we leave this space all in agreement that really technology, it's no longer an accessory to healthcare, but it's becoming an infrastructure. So if we shift our attitudes, and how we view AI and technology, I think we'll really, really go far. So thank you so much, for coming by. And like I said, they have booths, around. So please visit. If you find them in their booths, please ask them all those questions that you have. But for now, we're breaking for lunch. We'll be back at exactly 2 p.m. for the afternoon session and also a presentation. So enjoy your lunch, and let's appreciate this amazing panel one more time with a very big round of applause. All right, enjoy your lunch. We'll have a brief photo session moment with the panelists before they leave.